This is Diana Mahoney reporting for Global Medical News Network.
Morbidly obese adolescents who underwent gastric band surgery as part of a study at the Nemours Alfred I. DuPont Hospital for Children in Wilmington, Delaware, experienced significant improvements in metabolic syndrome risk factors. Dr. Kirk Reichard reported these findings at the annual meeting of the American Society for Metabolic and Bariatric Surgery.
About 6 months and again at a year, the significant changes were a decrease in weight of average 65 pounds, a dramatic improvement in their insulin levels and their insulin access. So while none of them were overtly diabetic, they were all insulin resistant, and that improved 75%. Other things that we saw were a decrease in their total cholesterol and triglycerides, and a trend towards an increase in the good cholesterol, or HDL. So a lot of factors that are really known to be important for long-term cardiovascular health that we're improving. Well, I think our findings, combined with the findings of the paper that was presented after ours, indicate that while these kids clearly are sick, they benefit probably more greatly from the lap band or any bariatric procedure, perhaps even than adults. And we know that kids will go on to be obese adults if they're obese kids, and they will go on to have cardiac problems. So our bias is that the younger we fix these problems, the more healthy they'll be later. Well, we're very selective in the kids that we operate on. They are forced to go through at least a 6-month preoperative phase where they're expected to do a lot of lifestyle changes. They learn a lot about nutrition and exercise, and they have to make a lot of appointment visits to the hospital. And those kids who are not able to do that preoperatively, we feel they're not going to be successful postoperatively, and we don't operate on them. We operate currently on about 40% of the kids that we put into the program. But I think that the changes that they're making, there's no reason to think they won't be durable changes. They really have been very receptive to improving their eating habits and in becoming more active. And as they lose weight, they want to be more active. And so that's been, I think that's bodes well for the future for them.
Reporting for Global Medical News Network, this is Diana Mahoney.